Hello everyone, welcome back to Dubai Healthcare Consultancy with a new vlog related to oral and maxillofacial surgery. If your specialty is oral and maxillofacial surgery and you are aiming to prepare yourself for upcoming prometric in-person view licensing exam like DHA for Dubai Health Authority, MOH for Ministry of Health, UAE and DOH for Department of Health Abu Dhabi, or other licensing exam like Saudi Dental Licensing Exam for Saudi Arabia, Oman Medical Specialty Board Licensing Exam, Qatar Council of Health Professional Licensing Exam, National Health Regulatory Authority Bahrain Licensing Exam, or if you are aiming to pass your Qatar Kuwait Medical Licensing exam, so this video is specially related to you. I would request to everyone to like and subscribe our YouTube channel so you will get the notification once we upload any video related to your specialty. So let's go and we will start the first question. We will start today, and I would request you to watch the whole video so at least you will get a good idea about different topics and how the questions are arranged, how you will get different questions in exam. So if you will read these questions properly and you give your output and like your feedback related to each question, so I believe that this small effort will help you in these in this way you will be able to pass your upcoming prometric in-person view licensing exam. So let's go to the first question of this vlog, which is related to the airway management. And the question is, a 36-year-old male presented with facial trauma after a motor vehicle accident. He has mandibular fracture and is in severe pain. He has stridor and difficulty breathing. What is the most appropriate intermediate airway management? So there are four options. Option A is endotracheal intubation via oral route. Option B is cryothyrotomy. Option C is nasotracheal intubation, and option D is tracheostomy. So read the question carefully along with question options, and then use your clinical and theoretical knowledge and decide which is the best option. So if you are going for option B, so option B is the correct option, and that is cryothyrotomy. An emergency interventional is like an emergency with airway obstruction due to facial trauma and limited access to oral and nasal intubation. Cryothyrotomy is the quickest and safest airway intervention. Let's go to the another topic, which is local anesthetic toxicity. So the question is, a 45-year-old woman undergoing extraction of impacted mandibular molar under local anesthetic suddenly developed circummoral numbness, tinnitus, and tremor. What is the most appropriate immediate management? Again, another question related to the management. So option A is give oxygen and monitor vital sign. Option B is stop injection and administer IV lipid emulsion. Option C is administer benzodiazepines for seizure control. Option D is start CPR immediately. The correct option is option B, which is stop injection and administer IV lipid emulsion. And the rationale is early sign of local anesthetic systemic toxicity require immediate cessation of the drug in treatment with lipid emulsion therapy. Let's go to the third question of this vlog, which is trigeminal neuralgia. A 60-year-old male presented with a sudden severe electrical shock-like pain on the right side of his face, triggered by touching the cheek. Which initial pharmacological treatment is most appropriate? This question is related to the medication and pharmacology. And question option A is gabapentin, option B is carbamazepine, and option C is amitriptyline, option D is ibuprofen. If you want to go for selection of option B, so I'm 100% sure that your selection is right. Option B, carbamazepine. Carbamazepine is the first-line drug for trigeminal neuralgia due to its sodium channel blocking effect. Let's move to question number 4 of this video, which is related to mandibular fracture management. A 25-year-old male present with the unilateral parasympathesis fracture of mandible. He is stable and has good occlusion. The best initial management is option A, enter maxillary fixation, option B, open reduction and internal fixation, option C is external fixation, and option D, conservative soft diet only kind of option. These are always kind of negative, like wrong option. So I would say this type of question is called like close-ended question, so better not to go for selection of this one. So if you will go for the selection of option B is the correct option. Open reduction and internal fixation displays parasympathesis fracture with a good occlusion are best treated with open reduction and internal fixation for anatomical reduction in early function. Let's move to the question number 5 of this vlog, which is related to pain management in postoperative patient. A 45-year-old patient underwent surgical removal of an impacted mandibular third molar on the first postoperative day. He complains of moderate pain. Which analgesia regime is most appropriate? Option A is ibuprofen, 400 mg every 6 to 8 hourly. Option B is codeine, 30 mg every 4 hourly. And option C is acetaminophen, 1 gram every 12 hourly. And the last option is option D, which is morphine, 2 mg IV every 4 hourly. The best option is option A, ibuprofen, 400 mg every 6 to 8 hourly. Non-steroid anti-inflammatory drugs like the first line of drug for managing mild to moderate forced extraction pain due to their anti-inflammatory effect. Let's move to the sixth question of this vlog, which is related to oral facial infection and airway risk. A 37-year-old male present with a severe submandibular swelling, fever, trismus, and difficulty swallowing after dental infection. The floor of the mouth is elevated and firm. And what is the most immediate concern? The number A, like option A is pain control, option B is spread to paraplegial space, option C is airway obstruction, option D is bacteremia. So the most immediate concern in this situation is airway obstruction. Ludwig angina is a rapidly spreading cellulitis of the submandibular space and can compromise the airway. Let's move to the seventh question of this video, and which is related to maxillofacial trauma, leaf fracture. A 37-year-old male sustained facial injury after a car accident. On examination, there is mobility of the maxilla when the upper teeth are grasped, along with epistaxis and orbital nerve paresthesia. Which fracture is most likely? Option A, Leaport 1, option B, Leaport 2, option 3, C is Leaport 3, and option D is zygomatic complex fracture. These are different types of fracture. You can go and study in more depth. The main purpose is to give you a little touch of different these topic, and the main aim is that you will able to pass your prometric in person view exam. So here if you will go for option B, which is the Leaport second, so your option is correct. Leaport second fracture, which is also called pyramidal fracture, involve the nasal bridge, maxilla, and infraorbital region leading to mobility of the midface. Let's move to the question number 8 of this video, and this is related to inferior alveolar nerve block failure. A 32-year-old patient requires extraction of lower third molar. Despite an inferior alveolar nerve block, the patient still feels pain during the procedure. Which is the most likely cause? Option A is overdose of anesthetic. Option B is accessory innervation from the myeloid nerve. Option C is allergic reaction to anesthetic. Option D is incomplete aspiration before injection. If you want to go for the selection of option B, so that is the correct option. The option B is the accessory innervation from the myeloid nerve. Failure to block accessory nerve supply is a common reason for inadequate mandibular anesthesia. Let's move to the ninth question, question number 9 of this vlog, which is forced extraction alveolar osteitis. A 40-year-old woman presented with severe 3 days after extraction of mandibular molar. The pain radiates to the air and there is a foul odor but no swelling. What is the most appropriate treatment? Option A is irrigation of the socket, placement of medicated dress. Option B is broad spectrum antibiotic. Option C is surgical debridement, and option D is immediate re-extraction. So in this scenario, the correct option is option A, irrigation of the socket and placement of medicated dressing. This is classic presentation of dry socket alveolar osteitis. The dry socket, this is a condition which is called alveolar osteitis, treated by local care and analgesia rather than antibiotic. Now let's move to the last question of this vlog, which is conscious sedation, related to conscious sedation. Question is, a 10-year-old child undergo dental extraction, is anxious and uncooperative. The dentist decide to use conscious sedation. Which agent is most appropriate? Option A, midazolam. Option B, ketamine. Option C, thiopental. Option D is halothane. The correct option is option that is option C, and option C is midazolam. Thank you for watching this whole video. I'm sure that these questions will help you to pass your upcoming prometric in-person view licensing exam for different health authority, which I mentioned to you, like DHA, DOH, MOH, the HAAD, Saudi dental licensing exam, and other health authority licensing exam. I would also again request you people to like and subscribe our YouTube channel so you will get notification once we upload any video related to your specialty. If you are aiming to start your career in these Gulf countries like Dubai, Saudi Arabia, Oman, Bahrain, Qatar, and Kuwait, so Dubai Healthcare Consultancy is the best platform to assist you for your health authority registration, data upload verification, and license exam booking. Simply you can contact to us on our WhatsApp number which is on your screen, and you can send us a WhatsApp message and we will help you for all the registration process. And this is always I say to you people, try to work hard and study well, and if you need more help and more questions related to your specialty, I will give you the link also related to our website. You can subscribe our question bank also. In this way you will able to study more and you will get more questions. These are just sample questions. If you go to our website, you will find more questions related to your specialty. Thank you so much for watching this video. Take care of yourself and have a nice day. Bye.